Good afternoon, and welcome back to another episode of House Call. Today's topic is actually quite interesting. We're talking about sexual dysfunction, which is a normal process of life. We see that a lot of men, when they hit their age 50 and above, the risk of sexual dysfunction actually kicks in. It's nothing to be embarrassed about. It's something that we can be fixed, and we talk about a lot of different treatment options that are available, and it's very important for you to know what we can do. Before we start and get into the anatomy, I want to speak to you about the difference between erection, excuse me, about ejaculation, and about orgasm, because people start to confuse these things. When we talk about libido, and main purpose of that is really different discussion for another day. Orgasm is the feeling of satisfaction, and of course, we're talking today only about erection and the blood flow to the penile tissue. And you can see from the anatomy here, you have the corpus cavernosa where the blood, actually the good blood flow comes in, and it prevents the bad or venous blood from going back. And by having blood coming in, that's when people get their erection. So all the discussions that we're going to have today is about the ways to bring in good flow to the penile tissue. Things such as diabetes, people that smoke cigar and cigarettes, they will have vascular disease. And many of these high blood pressure or high blood pressure medications can actually affect your sexual function. So how do we treat this? What's the best way to do this? There are a lot of oral medications. You've heard of Viagra, you've heard of Levitra, and you've heard of Cialis. Cialis is actually given sometimes on a daily basis that can help men with their urination as well as sexual function. That stays in your system for about 24 hours. It's fairly safe. Viagra and Levitra is given an hour before with empty stomach. But the purpose of all of these medications is really to increase the blood flow to the penile tissue and create sexual function. These are phosphodiesterase inhibitors. Doesn't mean anything to you, but what that means is that it relaxes and dilates the chambers where the blood will come to the penile tissue and cause erection. And it gives you a better sex life. Sexual function is absolutely important because there are many benefits about this. It's not only healthy, but it boosts your immune system, and it's excellent for the relationship, especially given all this pandemic and time that we've had. This is the best way to really take care of this if you're having problems. Oral medication is the best first line treatment, and majority of the time that works really well. You have to speak to your doctor before you take it. But there are also something called vacuum pump, and this is also something that's very easy. Vacuum pump is a tube that goes over the penis. It basically creates a vacuum, as it sounds like, and it brings in the blood into the penis and causes the erection. And basically, once you have full erection, you will put a ring at the base of the penis, and until you are done with your performance. And once that's done, then you have to take the ring off. This is also easy, and we use this a lot for people who even have had robotic surgeries to bring the blood flow and maintain it and prevent any penile shortening. Finally, the next option, which is also very common, is something called penile injections. The sound of it, every time you talk about penile injections, patients, they get really scared. They think, oh my God, how can I put a needle in my penis? But the bottom line, these are very small needles. It's easy to use. And the first time around, I'll teach you in our practice exactly how this works. But basically, you put in a tiny little injection into the cavernosal area, and we give medication that does the same thing as we spoke about by dilating the chambers, by bringing blood to the area, and hence causing erection, which is really important. It's fairly safe. Obviously, if you're on blood thinning medications, we got to be careful. And one of the side effects or complication of this is that over the years, people can form some scar tissue and the curvature of the penis called peyronie's. And that's one of the reasons why if you're on penile injection, it's best to basically alternate on the right side of the penis and the left side of the penis. and make sure you don't go in the same spot and cause scarring. But that works really well. So if oral medication has failed, if vacuum pump is not working, if people have tried even suppository called Muse, then I think penile injection is the best option after that. And it's fairly easy. And every time they want to use it, they get a tiny little injection, the blood flow will come, and within 5 to 10 minutes, they can perform. And finally, if everything fails, then of course there's penile prosthesis or implant. This is really an operation that is done in the operating room. There is a pump that we put in the scrotum next to the testicles, and you can see by squeezing this pump, you have fluid coming in to this prosthesis and gives you a full erection. And of course, there's another button that you press, it will make the penis to go down. So I think that there are a lot of options available. Obviously, this requires surgery. There's a small chance of infection. In the hands of experts who do a lot of these surgeries, these are fairly safe. It's a permanent solution, meaning that this prosthesis stays inside you. In some ways, people like it because it's always there. They don't have to go through all these injections, but that's a last resort. We start with oral medications, suppositories, vacuum pump, penile injections, and finally surgeries. So absolutely, you don't need to suffer from sexual dysfunction. We see even men in their 70s that come in and we can solve this. You obviously can call 212-365-5000, and you can go to davidsamadi.com and you can email me any questions that you have. And today, with all the teleconference capabilities, we can set up conferences with you and answer any of the questions you have. My name is Dr. David Samadi. I hope this was helpful. Send me any questions that you may have had. You may have tried some of these that may have stopped working, and I can fine-tune and change things and improve your quality of life, which is the purpose of all of our conversation. Remember, your health matters, and we're here for you. 212-365-5000. Thank you, and have a blessed day.